Welcome to QuickMedTalk, the online destination for medical lectures. Let's talk about acute tonsillitis and pharyngitis. By definition, acute tonsillitis is an inflammation of the tonsils. Frequently occurs in combination with the inflammation of the pharynx, tonsillopharyngitis. The term tonsillitis and pharyngitis are often used interchangeably, but they refer to a distinct site of inflammation. On epidemiology, peak incidence. Acute viral tonsillopharyngitis occurs in children less than 5 years and young adults. Acute gas tonsillopharyngitis occurs in children aged 5 to 15 years, rare in children aged less than 2 years. Peak season. Acute gas tonsillopharyngitis most commonly occurs in winter and spring. On etiology, acute tonsillopharyngitis is caused by viruses like adenovirus, rhinovirus, coronavirus, influenza, and parainfluenza viruses. Bacteria like acute gas tonsillopharyngitis, which is the most common, and Neisseria gonorrhea. Recurrent tonsillopharyngitis and chronic tonsillitis are caused by aerobic bacteria like Streptococcus, Haemophilus influenza, and anaerobic bacteria. Clinical features. Acute bacterial tonsillopharyngitis presents with sudden onset of symptoms like fever, sore throat and dysphagia, pharyngeal and tonsillar erythema, cervical lymphadenitis, and absence of cough. Acute viral tonsillopharyngitis presents with cough, rhinorrhea, oral ulcer and anterior stomatitis, conjunctivitis, and absence of fever. Diagnosis. We can do a throat culture for gas, a complete blood count, inflammatory markers like CRP and ESR, antistrepton lysin O-titer, and a rapid antigen test for gas antigen. On the right, there's a modified central score, which gives an approximation of the etiology of pharyngitis. Treatment. Provide supportive care by giving analgesia and antipyretics, antibiotic therapy if gas is confirmed. Acute viral tonsillopharyngitis is self-limited. Supportive care of sore throat. Ensure adequate hydration. Consider household remedies such as saltwater gargles. Consider oral topical local anesthetics, example, Vasocaine lozenges, throat spray, and mouthwash. Analgesics and antipyretics. Surgical management. We can perform a tonsillectomy. Indication for tonsillectomy. Extreme hypertrophy of the tonsils, kissing tonsil, documented recurrent throat infection, suspected tonsillar neoplasm, chronic tonsillitis, history of peritonsillar abscess, and allergy or intolerance to multiple antibiotics. Complications. Suppurative complication of acute tonsillopharyngitis can be otitis media, sinusitis, deep neck infections like peritonsillar abscess, parapharyngeal abscess, and retropharyngeal abscess. Non-suppurative complications of gas infections are acute traumatic fever, scarlet fever, and post-streptococcal glomerulonephritis. Thank you. Do not forget to like, comment, share, and subscribe. In the bio, you find the link to our Instagram, Facebook, and SlideShare account.